Well, A&E departments have largely been free of drunk and disorderly patients during lockdown. But now medics say that they're expecting the worst as pubs open this weekend. Well, the president of the Royal College of Emergency Medicine, Katherine Henderson, joins me now. Afternoon to you, Katherine. Are you worried about what's being described as Super Saturday?
Yes, I think describing it as Super Saturday doesn't really help in some ways. I think it gives an expectation that people will behave in a particular way, which hopefully they won't. I mean, European countries have glided back into having restaurants and bars opening without it having to have all this drama. So we would rather that everybody understood that health service is still pretty fragile. It's still working quite hard. It's still got a lot of difficulty with keeping patient streams separately. And we're very, very keen that nobody ends up in an ambulance, in an emergency department, having got so drunk that they need our help.
So it's the last thing you want to be devoting resources to at the moment. How are hospitals preparing for it, though, in case it does happen?
And I think this is one of the things that's really difficult about this. We're having to think about putting on extra staff. We have extra staff on our rotas for Saturday. The weekends staffing in hospitals tends to be a little bit lower. And to actually have to say to people who've been working throughout the coronavirus pandemic, would you mind doing an extra shift on Saturday because we're worried that there's going to be demand for our services, just feels a little bit difficult.
Yeah, I'm imagining, though, that throughout this very difficult period of the pandemic, you haven't seen many drink-related admissions.
There's been about a 60% reduction in alcohol presentations. It's going back up. We can understand that that's going to happen, and that's part of the general workload of any emergency department. And in some ways, great. You know, society's getting back to a bit more sort of normal, if we can call it that. But what we don't want is that tomorrow does become a kind of New Year's Eve type celebration. We just can't afford to do that.
You mentioned staff there and having to put extra staff on standby potentially to deal with this. I mean, they've put themselves on the front line, haven't they, with this pandemic? You can understand they might not have much sympathy for people presenting with alcohol-related emergencies. How is staff morale, particularly in the emergency departments?
So it's a story, it's sort of two-half story. There's the one half, which is everyone has worked incredibly together. You know, there's been more joint working and determination to get through this than I've ever seen before. Cross-specialty cooperation has been fabulous. But the other side of it is that people are actually very tired. They've been through a lot. They've seen a lot. The ambulance service has been through a lot. I think we've all got to recognise that the system has worked very, very, very hard, and we've got to try and get things safe as we move on. We need to have ability to manage really sick patients safely. And everything takes longer when you have to dress up in PPE and you have to clean, you know, every surface after seeing a patient. So it's quite hard at the moment.
Yeah, and you were mentioning there, Katherine, that, you know, the number of drink-related people presenting to emergency had really significantly fallen. There was concern, wasn't there, about people coming to hospital with other serious problems and deciding to stay away. Is that normalising a little bit?
Yes, we're glad to say that a lot of the patients who we should have been seeing are beginning to come back. But to do that, they have to feel that it's a safe place to come. The last thing we want is for somebody who gets chest pain and thinks they're having a heart attack to go, you know what, I think I'll just leave it because I'm worried about going into hospital because I might catch COVID. Now, the problem with getting very busy with people who've maybe drunk quite a lot is keeping people safe in that situation is just a lot more difficult.
Yeah, OK. Well, really interesting to talk to you. I wish you and all your staff lots of luck this weekend. Katherine Henderson, thank you.
Thank you very much.